I'm Dr. Gökay Bilgin from Smile Hair Clinic. So I want to show you one of my previous patients before progress and results. So you can see our patient comes for the frontal part and his redraw of his hairline. He has tiny hair at the back. His hair is not particularly thick. If you can see, we can clearly see the scalp in this zone. So it means that actually it's not the densest hair on the donor zone. He needed implantation for a small zone. So what we did is, first we shave, of course. We draw the hairline. This is only the level of the line, and the end result will not look like this. I will show you the operation pictures too. You can see here that we made some zigzags to make it natural, and we make some irregularities in the frontal line to keep it natural. So we implanted, it's written here, we implanted 3000 grafts to him, and after 1 month you can see the red part. Okay, you can see the implantation zone here. They are mostly shaded, and there's nothing left there much more. And I want you to show you the donor zone's condition after 1 month too. So you see, there's not much more difference than before, but it will look much better in the next months. Of course, I will show them too. So what we did for this patient is we did first the incisions. If a patient is completely bald and he needs for the top and the crown too, we first extract as much as we can, and then we perform our incisions according to that number. But for the people who needs less, if we are sure that we can extract the amount easily, we first do incisions. This has two benefits for us. The first is we don't estimate a number, and so we directly extract as much as the incision numbers. And the second benefit of it is the wait time of the grafts in the table is shortened, so their survival rate and our success rate is increased. I will show you the 3rd month. The hair started to grow in the 3rd month, but this may be delayed to the 4th or 5th month. Even for some patients it's 6 months actually, but in this particular patient, it started to grow in 3rd month, so probably since he started to see some improvement, he becomes happy. And the donor zone is healed a little bit more in this picture, but it will heal much more, of course, in the upcoming months. So I want to show you how it looks from size in the 3rd month too. There's small hair, like baby hair, on the sides too. So you see he started to style it already. So it's really a blessing for someone who really needs a particular look. You see, in 6 months they become much more thicker. The density is also increasing. So still, in the 6 months it may look artificial. It may not completely be natural, and I want you to check this part too. This is why we don't do perfect lines. Hairlines. This is why we do some zigzags and irregularities. It is the best way to achieve the natural look in the hair transplant. Yes, you see, this is a much better shot, and even it has a higher light density in the photo. It's pretty much denser than the other photos. And the 9th month. Yeah, you can see it looks really nice, natural, and he styled his hair as he always trimmed before. So yes, you can see it looks natural and nice. One thing I always love to ask my patients is somebody realizes that they had a hair transplant, and they mostly say no to me. No one understands. Maybe their barbers understand. And you can see donor zone is fully healed, and even he kept this short. You cannot understand that he had a hair transplant before. So he's another happy patient. Thanks to him for letting us to share his photos. Bye-bye.